This is the Pet Buzz. And here's the dynamic pet duo.
And joining us today to discuss this really very important study is veterinarian Dr. Grace Edmunds, clinical veterinary research fellow at Bristol Veterinary School. Dr. Edmunds, we are pleased to welcome you to the Pet Buzz today.
Thank you very much. Thank you. It's great to be here.
Well, we're excited to have you. So I'm going to start out with a really basic first question because I don't know, obviously, as much as the vet's on at hand. So what is osteosarcoma?
So osteosarcoma is bone cancer, really, and it's a big problem in both dogs and cats, and also humans. So about 3 in a million adolescents will get osteosarcoma every year, and about 81 in a million dogs. And that doesn't sound like that many, but the reason why this is a really big problem is because these tumors are very debilitating. They cause severe pain. Our treatment options haven't really changed in 30 years. And our survival rates are not brilliant. So there's much research that needs to be done to try and combat the effects that this has on the lives of our dogs.
Wow, really important to know about. I'm glad Dr. Edmunds is here with us.
It's a devastating disease, really.
It's really sad.
So share with our listening audience your recent study. Talk to us about it.
Well, it's a super exciting study because it's massive. So it's a huge collaboration between the universities of Bristol and Cardiff in the UK and the Royal Veterinary College. And we had access to this fantastic database of 1,700 osteosarcoma cases, which were biopsied at a lab in Bristol, and about 900,000 control dogs. So that means healthy dogs. And this enabled us to statistically analyze which dog breeds and body shapes are the most at risk of osteosarcoma. So briefly, if there are more of a certain breed in the cancer data set than in the healthy data set, then the statistics can tell us whether that breed is more at risk.
Okay, so let's talk about the results of the study, because I mean that's what we need to know.
That's the meat.
That's the meat.
For sure. So we found that 16 breeds were significantly at higher risk when compared to crossbreeds, and at the top of those were the Rottweiler, the Rhodesian Ridgeback, and the Great Dane. And the kind of new finding there is the Ridgeback. We didn't know that before. But also in our study design, we were able to look at which breeds are protected, and we found that 8 breeds were at significantly less risk than crossbreeds, and that was especially the French Bulldog, the Bichon, and the Cavalier. So the main difference between our study and previous ones is that ours was much bigger, and this gave us greater statistical power to see these kind of intricate patterns in the data. But also we had this huge database of healthy dogs to compare to, and that was really novel.
I'm just curious because I know you have a question, Dr. Volley. Can you give us a few more breeds of dog, of the larger dogs?
Sure, so a few more of the at-risk ones. So Mastiffs were also up there. German Pointers and Pinschers, they were also in the kind of significantly at-risk group. And then going down a little bit, so more like 7 times at risk rather than 10 times at risk, we had Greyhounds and Lurchers and Collies in there as well.
Interesting.
And it's also true, practicing veterinary medicine for as long as I have, I've seen this in every breed you're talking about. What did you all determine regarding the larger breeds versus smaller breeds, though?
Because that's a great question, because she just started talking about the differences.
Right.
Yeah, so we also looked at body size and body shape. So this was also quite new. And overwhelmingly in the scientific community, we knew that larger dogs were at risk. We knew that anyway, and we kind of found that. So that was nice, that matched up. But then we also found that those dogs with shorter skulls or shorter legs, so we used the kind of, the pugs and the French Bulldogs with the shorter skulls, and then we used the Dachshund type breeds with the shorter legs, that they were less at risk. But I guess it's really important to say, and I know that many of your listeners will have a real grasp on this, is that breeding for any extreme body shape is likely to carry health risks of its own. So although we've shown that breeding for extreme tallness and extreme largeness is likely to increase your risk of bone cancer, we don't want to swing too far the other way and breed for extreme smallness either, because that can cause its own problems.
You know, it's interesting. We started to talk a little bit about, in the beginning of the interview, about the human comparison. So I wanted you to talk a little bit about, how does your research compare to the research that humans that are suffering from osteosarcoma?
We found really, really similar things. So we know from human literature that those people with a larger body mass or longer legs at the time of puberty are more at risk of osteosarcoma. So that fits really well. And also the age distribution. So in dogs and in humans, this is a disease of kind of teenagers, like teenage aged dogs and humans, and then also older people. So there's what we call a bimodal distribution. We get two peaks. We get one in young people and dogs, and one in older people and dogs, and we that mirrored as well. And then there's some genetic data, not ours, but from other studies, which matches as well. So they found similar genes which seem to put both humans and dogs at risk. And surprise, surprise, those genes relate to skeletal growth and body size.
That's really interesting. I was just curious. I guess from the interview, what can breeders as well as pet owners take away from this research?
Well, I think it's important that nobody panics because, the incidence of this disease is relatively low. We don't have exact numbers, but, about 8.1 in 100,000 dogs. But the key message is that if you're the owner of an at-risk breed or body shape, so more than 40 kilos or the Rotties and Ridgebacks and Great Danes, that you just check your dogs over regularly, for lumps and bumps on the legs or the head or the skull or any sudden lameness, just get them checked out by your vets. Breeders, we've just talked about basically avoiding the extremes within any breed. And, there's some fantastic breeders out there and some fantastic information on the UK and the American kennel clubs about how to breed for welfare. And what we don't want to do is try and breed out osteosarcoma and then breed in something else instead by like massive selection. So yeah, that's the advice.
Yeah, just as a little sidebar, we're really talking about diagnosis and just the presence of the disease. We aren't even going to be talking about the treatment of the disease, but really our listeners should probably know how serious of a problem this is. Can you just explain real briefly what are the options for treatment?
Yeah. So I think that you might do different things in the US to what we do here in the UK, but our standard of care is generally surgery and chemotherapy. And sometimes we can try and do limb sparing surgery, which means we try and help the dog to be able to keep the leg. But really sadly, because the tumor causes such extreme pain, in many cases the leg needs to be amputated to control the pain. And really, really sadly, even if we take away the primary tumor, so if we take away that leg, 90% of these tumors have already spread at the time that we find them. So the survival times, they're not terrible. For canine cancer, a year to a year and a half average is actually a good survival. If we put that in human years, that's 7 years in human years in a dog year, right? So it's not terrible, but it could be better if we had better treatment.
It sure is a crummy disease, isn't it?
It's a crummy disease, but it sounds like it's a very expensive disease. Wouldn't you say, doctors?
Well, for the treatment options, talking about.
Sure. If you're doing radiation or chemo.
And I want a doctor to share with the people the drama of it, really, because amputation is really what's has to be done.
Sure.
And that really is very shocking to the pet owner.
So, Dr. Edmunds, I'm curious, since this happens with a lot of bigger breed dogs, when shopping for a puppy, because we know so many people have been looking for puppies, adopting or shopping for puppies, should you go with a smaller dog in a litter versus the biggest dog representing that breed?
So I think if you're looking within a litter, that litter are going to share a lot of genes. So that's not going to be making a giant difference in the long run. No pun intended. But I think actually, if you're thinking more widely, within any breed, so a big breed like the Great Danes, if we were to, sort of focus on the kind of middle-sized Great Danes, and the Kennel Club have loads of information about this, then within that whole breed as a whole, we're avoiding pushing for those extremes. So we're not breeding the very biggest Great Dane with the very biggest Great Dane, and that's what is not really my area of expertise, but that's what the Kennel Clubs are there to advise about at the moment, and they're doing a fantastic job with that.
Hey, and I bet you my feline listeners are really concerned about this too. So what's next in your research?
So we do need to look at cats. You're absolutely right. We don't see this very commonly in cats, but someone in our hospital has just got one today. So you're right. And Vet Compass gives us the material to do that, and VPG histology. But for me, the trick will be involved now in doing the genetic studies and finding out what genes put us at risk. Because if we can do this, then we can use this data in two ways. So one is enhanced surveillance. So we can find out which dogs are the most at risk, and then we can do more screening screening with those dogs, like if you were a human and you carry certain breast cancer genes, you get screened more often, right? Like many of our listeners will be familiar with that. The other thing we're looking into is liquid biopsy. So these are this fantastic new technology. It's a long way away yet, but it'll be able to tell us hopefully if there are bone cancer cells in your body, even when we can't see the tumors with the naked eye yet. And knowing what genes make a bone cell into a bone tumor cell is really crucial if we're going to develop those technologies.
Wow.
She's awesome.
Fascinating.
She's awesome.
Oh, well,
Thank you.
we knew right away we're going to have you back.
Thank you for listening to this episode of The Pet Buzz.